Hi everyone. Rhys back with another session, talking to today fantastic podiatrist from South Australia, Michael Nitschke. Nita, good afternoon. How are you?
Yeah, good mate. Thanks for having me today.
It looks a lot nicer in the background than what it did here a few days ago. So I'm
Yeah,
sure we're
no,
both glad the weather has improved slightly. Um,
absolutely.
Nita, you're the director of podiatry at Spark in
Yep.
SA. You're the coach of the Adelaide Uni Runners. And then you co-host with good friend of the show, TDC, at Inside Running podcast. You've been a
Yep.
podiatrist for how long?
It's been going on my 18th year now, Reece. I reckon I'm a veteran, I think, statistically now. So,
Absolutely. And you've got a
yeah,
wealth of experience. You're obviously heavily involved, in the running community. And your insight in biomechanics, is almost unparalleled. So thank you for joining me. And yeah, today, I guess we're going to talk a little bit about how you incorporate orthotics in
yep,
your clinic.
yep.
So tell me, what do you do, Nita?
Look, so being in sports medicine all the time, orthomechanical, treatment regimes are relatively a high percentage of patients that we'll see clinically, whether they're prefabricated or customized. And I guess I've always taken a very tissue stress approach to managing injury in general. And I've always thought that orthomechanical devices, you could utilize the tools as a way of being able to, you know, distribute load differently, shift load, offload an injured tissue. So my ethos of always managing lower limb pathology has always been, treat it to tissue pathology first, and then manage the structure of the lower limb secondary to it as well. So we're lucky that we have, the skill set and the advancements of technology allowing us to use orthomechanical devices quite precisely to manage common foot injuries and lower limb injuries.
And how you spoke about the tech, how has that tech changed over your 18 years as a podiatrist, and particularly the last 5 years? We've probably seen advancements, that were superior to the 15, prior. How those changes? What are those changes that you've seen?
It's the specificity of it. So, for example, taking load from one part of the site, say the rear foot or the midfoot or the forefoot, and being able to, offload one region specifically has just been a little bit easier using scanning technology. And then obviously, even labs like Footworks now have like quite precise prescription variables for us to be able to use now. And even that over the last 2 to 3 years has got better and better and better. The additions of being able to change stiffness at different levels of the orthosis from one site to another, or make it more compliant in some areas, not just add to be able to change function, but also add to the comfort paradigm of an orthosis, which is huge for compliance and adherence from the patient. And we're seeing that happen more and more now as well. The materials themselves are becoming, a lot more modifiable as well. But when they come to you at baseline, a lot of the times the modification process isn't really required like it used to be. Sometimes you'd have a more dense material or shell of an orthosis, and along the way you had to create a lot more hand modifications yourself to try and get the comfort correct. And
Yeah,
whereas often now we can get it at baseline from the scan and the script, and we can create sweet spots and variables that are just better from the get-go.
yeah, yeah. Certainly, you probably worked with Polly for a long period of your initial podiatry career, and I certainly remember, heat
Yeah,
manipulating, bending, grinding,
absolutely.
changing the orientation of Polly, and EVA, even
Hmm.
now still doing the same. But certainly,
Yeah,
I've found in the last sort of 5 years, since the rise of 3D printing and 3D
yeah.
scanning, as you mentioned, that technology has really, I suppose, decreased the need for post manufacture modification. Would you feel the same?
And absolutely. And look, even the additions of the device being one whole material being the same rather than variable materials on the one shell, adding ethyl vinyl acetate to the rear foot and forefoot post, we can tend to, change a lot more within the shell itself now. So it's more minimalistic, so to speak, and durability doesn't tend to be affected dramatically. And, but, it just means at baseline, you just got, more than likely less wear and tear to be able to adjust in the future as well. So you probably have a little bit
Yep,
more longevity in some of those rear foot, forefoot orientations of the device.
absolutely.
Mm.
Look, it's a great segue. We spoke earlier how you first introduced me to, the use of intrinsic heel lifts.
Yeah,
Prior to probably, my, let's say, exposure to your prescribing, I always used an EVA edition.
Yeah.
How did the use of intrinsic heel lifts come about? Where did that first start in your mind?
Uh, I mean, look, I had a conversation with Art. Like, I suppose because I deal with a lot of the running population, we saw a large change in, say, like the orientation of the pitch of shoes. So, like, the common pitch of a shoe was always around about 10 millimeters and sometimes 12 millimeters. And often, probably since 2015 onwards, we've seen a higher range of shoes of 6 millimeters, 8 millimeters. 8 millimeters almost being the standard of a pitch now, which means when you put an orthomechanical device into a shoe with a lower pitch, if you had a post on the rear foot, for example, if I had it quite level, I started utilizing intrinsic pitches at a slightly higher density than, say, an EVA pitch. It would sit into the shoe and it would sort of raise the rear foot relative to the midfoot. And just with, say like a shoe like a Hoka, which was like a 4 millimeter pitch along the, or 5 millimeter pitch along the line, often people would find a little bit more irritation in the medial longitudinal arch. So when you raise the rear foot up as a pitch, you'd find that it will bias, it will bring the ground up towards the rear foot. And there was much more comfort in rear foot control using
Mm.
the orthomechanical device. And having an intrinsic based pitch using the nylon material to be able to be in the actual orthosis as the one piece of shell, it sort of would embed itself into the shoe a little bit and it would be relatively durable. You wouldn't have to change it as often. And and look, it just meant I was doing less modification to the rear foot of the orthosis, but it was more comfortable in lower pitch shoes. So,
Mm.
and since then I've continued to use it because of durability purposes and perhaps maybe a bit more force. You could create medial or lateral to the subtalar joint axis using a post that wasn't as compliant like an EVA material.
Yeah, and as I said before, I certainly first, I think, understood the indications and the theory of the intrinsic heel lift through you,
Mm.
and I myself, with the little orthoses that I prescribe nowadays, I don't use it exclusively. I certainly use it
Mm.
where I see the need for it long term, and
Yeah,
like you mentioned before, the Hokas, they were
yeah,
such when they were really first, introduced into running society, they were such a different pitch shoe, and that's certainly one of the
yeah.
indications that I use it for. What else are you using it for? The intrinsic heel lift.
Look, it's there. I mean, there are some contraindications to using it, of course. Now that foam's a bit got softer within the shoe complex as well. So when I talk about it, the pitch being a bit more sustainable long term, if you place it into a say a dense midsole, for example, the pitch would be
Yep.
more. It'd be more relative. It'd stay up a bit higher. If the shoe was really compliant, it'd embed himself into the shoe. Wouldn't function probably quite as well. So often I was using it with shoes with higher density foams as well, just to make sure the pitch was there. And obviously, if you use a really soft rear foot posting or a pitch at the rear foot, it does become more compliant. You put it into a shoe that's denser, it doesn't act as a pitch quite as well. When in a
Yep.
functional setting, you hit the ground, it compresses more. It doesn't compress as much
Yep.
unless the material that it sits on is soft. It obviously compresses into that material. So I'm still using it and connecting that sort of intrinsic pitch into a slightly higher durometer foam.
Mm.
And usually that would be a person with a higher body mass index as well and things of that nature, usually presenting with a higher dense foam shoe as well. So in a durability setting, it's relatively important to use that. The rear foot control aspect, I sort of mentioned to you when we weren't recording that. I guess a lot of my orthoses end up being quite biased towards rear foot control, and it definitely tends to create more stiffness properties at the rear foot as well. So still something I tend to use when the orthosis is aiming for a bit more force behind the subtalar joint axis and or adjacent to the medial or lateral side. We can do that, I think, better with a slightly firmer pitch and a slightly firmer posting.
Undoubtedly, I think
Mm,
balance and therefore balance of the orthosis and therefore your correction of the orthotic. It's not too dissimilar to putting something like a post motion grind on a traditional heel stabilizer, where you
absolutely,
decrease the balance and therefore you may take in theory 3 or so degrees off. I mean,
absolutely, yeah,
a perfect case that I've found, whilst it be few and far between, is like a structural anterior ankle impingement. I mean, someone that
absolutely,
has
yeah,
that structural anterior impingement, they're always going to have that structural impingement.
yeah, yeah,
So something sort of more rigid along the line of an intrinsic heel stabilizer and heel
yep.
lift. That's always going to be warranted for
And
that
w-
case.
and there are so many clinical examples now when people just get like a huge pain relief by lifting the rear foot up closer to the lifting the rear foot up, opening up the front of the ankle axis, and connecting them with a denser rear foot that's pitched and a forefoot with maybe a rocker that helps the assistance in the sagittal plane, you can really offload the ankle joint. And we work in a clinic that's a sports and arthritis clinic, and we see a lot of ankle OA and midfoot OA, and usually that rear foot control and that slightly higher density at the rear foot tends to be advantageous to be able to open up the front of the ankle a touch more.
Yeah, and undoubtedly you're going to get exactly what you just said out of intrinsic nylon compared to any density 350, 450. You're not going to be able to reproduce the same level of control, with EVA. Mate, thank you so much. I'm sure people will get a lot out of the use of intrinsic heel lifts and other, I suppose, aspects of our conversation today. Thank you very much for joining. And, everyone should definitely tune into the Inside Running podcast with you and Tommy. It's definitely something that everyone can learn a thing or two from. So thanks again, mate.
Cheers. Pleasure, mate. Thank you.
Thanks, Nita. Bye-bye.